Hi, welcome back. This is Neurofeedback Foundations, Module 38, IQ and Achievement Testing. IQ tests measure someone's potential for academic achievement. The best tests are free of cultural, ethnic, and schooling biases. For example, a 12-year-old who has never gone to school, maybe from Ukraine because of economic and societal issues, might be able to be tested for his or her potential to learn. Having said that, there are no perfect tests. All tests compare to age-matched controls or norms. Exposure to a stimulating environment with lots of reading materials and math manipulatives from a young age is going to impact IQ. In fact, World Data website claims that the warmer climates negatively impact IQ, but I don't think it's really the climate. I bet that the colder weather forces people inside, and up until recently, when there was excessive screen exposure, that forced children into books, and they learned a lot. That's just my theory. Anyways, we do the best we can. IQ is important for us to flesh out potential learning disabilities and processing problems. We compare every other score that we obtain during our testing time to the person's IQ, especially their achievement. So here you can see that the normal IQ for the average population is 100. That is the average. And 68% of the population falls within one standard deviation, plus or minus 15 points. So the vast majority of people fall between 85 and 115. 2 standard deviations would be down to 70 and up as high as 130, and then 145 or higher, only 0.1% of the population, or below 55, only 0.1% of the population falls in this range. Now, when if their IQ is indeed 100, and we, for example, we get a math test score of 101, that would be considered normal. A problem is considered anything 20 points below the IQ. So, for example, if someone got a math score of 80, we would say they likely have a math learning disability or dyscalculia. However, if their IQ is 90, we would not say that they had a problem at 80. They would have to have a score of 70 or lower to have a problem. Conversely, if someone were in the high end and had a score, an IQ of 120 or maybe even 140, a score of 100 on the math test might be normal for the general population, but for that individual is a sign of a math learning disability. Even if they got 120 on the test, but had an IQ of 140, they would still qualify as a math learning disability. So my point is, IQ is very important. Anything 20 points below the IQ for spelling, reading, math, or even our attention scores on our continuous performance tests would indicate a problem for that particular individual. The very first IQ test developed was in 1905 by Alfred Binet and Theodore Simon. It was called the Binet-Simon test. The first revision was by Louis Terman, and the name was changed for the Stanford-Binet test, which is still widely used today. In 1939, David Wechsler published his IQ test, which was the first to actually separate out verbal and nonverbal IQ. This test is also widely used today. For our clinic, we have chosen two different IQ tests, the Tony 4 and the Shipley 2. The Tony 4 is a language-free intelligence test which requires no reading, writing, speaking, or listening on the examinee's part. It is completely nonverbal if needed and largely motor-free. The test taker merely points, nods, or blinks to indicate the chosen response. The Tony can be used on ages 6 to 89 years, and there is a younger version, the P-Tony, that can be used on individuals from the ages of 3 to 9 years, 11 months. The Tony takes 15 to 20 minutes to administer, and the P-Tony only takes 5 to 15 minutes to administer. Because this test is language-free, it's ideal for testing individuals who have previously been difficult to assess. For example, people with communication disorders, learning disabilities, or problems caused by low IQ, autism, stroke, head injury, neuropsychological impairment, or diseases such as meningitis and encephalitis. It also accommodates the needs of individuals who are not proficient in English. The 4th edition was standardized on a nationally representative sample of more than 2,200 people ages 6 through 89, with norms stratified by age, gender, race, ethnicity, geographic location, and socioeconomic status. To administer the Tony 4 exam, have the student or individual seated in a comfortable chair. Begin testing with training item T1. Point to the empty box in the stimulus portion of the item at the top of the page and say, which one of these? Run your finger along the bottom of the page. Goes in this box. If the examinee points to the correct item, proceed to the next page. Follow the same instructions for T2, then turn to T3. Do this one by yourself. Allow the examinee to complete the remaining training items without prompting, if there is clear understanding of the process. Re-administer the training items if the examinee does not appear to understand what is expected. Discontinue testing if the examinee still does not appear to understand what is expected after the second administration. Once the examinee demonstrates understanding, then proceed to the actual test items. Before proceeding to the actual test, make sure that the Form A, matches the test you are administering, A. Then, run your finger along the bottom. Which one of these belongs in this box? Mark your answers on this page. Start with 1 for ages 6 to 9 years, and then 20 for 10 years and older, unless there is a concern for significant intellectual disability. Page 2 has instructions for nonverbal clients and instructions for scoring. The examiner's manual has tables for converting raw scores into standard scores by age. Again, make sure that you're using the correct table. For example, this is table A, because we used Form A. Further back, you can have the raw scores be converted into age equivalents for school age and then percentile scores. The Shipley-2 is another IQ test that we use here at Scottsdale Neurofeedback Institute. This IQ test provides a brief yet very robust measure of crystallized and fluid cognitive ability. So crystallized IQ is what people have learned already, but fluid cognitive ability refers to their ability to learn. And so it's a very good way of estimating the overall cognitive functioning or impairment. And sometimes we do both the Tony and the Shipley-2, and it's amazing. We get very similar or exact same results. So they're both excellent. This test, the norms are based on a representative sample of 2,826 individuals. It presents, it's all stratified by age. There is a vocabulary scale, which is definitely going to be more reflective of crystallized knowledge. And then there are abstraction scales and a block pattern scale, which are more fluid cognitive ability. So for example, on the vocabulary scale, if someone does not read much because they have ADHD, their score may be lower than the block pattern scale. So we would lean more towards the block pattern scale for their actual IQ. So both of these are excellent tests and very robust and easy to use. To administer the Shipley-2 IQ test, have the client or patient seated comfortably at a desk. You may take off the first page where the examiner enters all the bio data and will keep your scores. The vocabulary portion of the test has the instructions. Make sure that you read the instructions to ensure understanding. Tell the client to circle the word that has the same meaning as the one written in all capital letters. If you want to change an answer, draw an X through your first answer and then circle your new choice. Ask the patient or client to press hard when making responses. For example, what word is the same or similar to large? Is it red, big, silent, or wet? It's big, so the client will circle big. Walk through number 1 and then allow them to finish the entire test. They have as much time as they need. The second portion of the test is the abstraction portion. This one is timed, and the client can skip from one to the next and go back to ones that they couldn't figure out. Explain to the client that this is all about patterns, and there is only one dash per letter or number. Here is an example. Big, little, high, low. What's the pattern? Well, we notice the pattern is opposites. So cold. What is a 3-letter word that is the opposite of cold? Hot. Here is another example with digits. 1, 3, 5, dash 9. What one number is missing? Well, these are odd numbers. so the number is 7. Try the rest on your own, starting with number 1. Encourage the clients to guess if they don't know. The final form for the Shipley 2 is block patterns. Explain to the client which block is missing. We're matching this to this. So we can see white, white, black, black. Half with the upper right darkened. What is here that is missing here? Is it A, B, C, or D? Well, we can see it is a blank square. So we're going to choose C and darken the circle for C. Have the client fill the remaining ones on their own. The Wide Range Achievement Test, or RAT-5, is an achievement test that measures an individual's ability to read letters, words, comprehend sentences, spell, and compute math problems. We use it on children's ages 5 through adult, and this is where we can use specific areas compared to overall IQ and help determine if the individual has a specific learning disability. We use the RAT-5 for achievement testing. The first booklet is simply for keeping records. Fill the top with a biographical information, the date, date of birth, and chronological age. The other pages in the first booklet will be for keeping scores. The response booklet is for the client. Instructions come with the RAT. Be sure to read them carefully so that you can grade appropriately. Math is given with a 15-minute time limit. The lower portion is only given for younger ages. An automatic score of 15 will be recorded here for older individuals. Spelling is on the back. And letter writing portion is only again for the younger ages, and for the older ages the client will be given an automatic score of 15. So you don't have to do this portion for the older ages. All the instructions are in here. This is for the letter writing portion. This is spelling. And then word reading, we have a sheet. This is the spelling list for the examiner to read to the examinee. This is the reading list that we hand to the client. We have it in plastic so it can be wiped down and kept clean. The younger ages will identify the letters. The older ages, again, we can skip and just write 15 in this portion. And we just have them read from left to right, checking off on here what they get correctly. Again, detailed instructions are in the response, in the record form that the examiner will have with them. When you're done, we have a norms book to, again, for the age, convert the raw scores. So if this were a 20-year-old, we'd find the reading raw score. Say it were 47, we'd come across here and we'd find the standard score of 79. You can see it for spelling, math, sentence. We don't usually do the sentence, but you can if you want. Here's for 17-year-olds. 13-year-olds. Again, make sure that you're on blue forms, using the blue forms. There are also green forms, so make sure you're using the correct form for the test that you're grading and administering. Okay, so the pediatrician in me is going to come out here because I think this is very important to talk about what impacts IQ. So obviously genetics impacts IQ. We are born with potential, but we do know that there are other things that impact IQ, like exposure to books and manipulatives early in life. So parental attention, talking to your baby, picking your baby up, reading books from an early age. And then good quality education with the ability to, again, have access to books and manipulatives. Good nutrition. Okay, your body can't grow, including your brain, if you're not adequately nourished. Sleep hygiene. So kids who are put to bed at a regular time every night and get adequate sleep and do not have issues such as obstructive sleep apnea, which is very detrimental to the brain because of intermittent cessation of oxygenation. That is going to impact IQ and brain function. Lower exposure to pollutants like lead and mercury. We know that lead and mercury toxicity have a very detrimental impact on the brain, and where kids are exposed to excess lead, they have lower IQs. Musical training in childhood is very beneficial, and a lot of kids just don't have that opportunity, but that is excellent for brain development. Lower incidences of infectious disease is probably one of the greatest impacts on human health and brain development. This is a picture of Giardia here. You can see in the lower right photo. Because what happens is if there's a lot of energy going towards fighting off infection, the energy needed for exploring the environment and just basic growth of the brain and the rest of the body is taken away from. Also, parasites oftentimes in the gut, as in the form of Giardia like this, or worms, which are even common in the United States, take away nutrition and oftentimes cause microscopic bleeding from the gut. Iron deficiency is the #1 cause of mental retardation, preventable mental retardation in childhood. So good access to care. So the last is higher socioeconomic status. That's hard because if you have a higher IQ, you're going to tend to have a higher socioeconomic status. So which comes first, the chicken or the egg? But then other things like being free from lead and being free from other pollutants and having access to quality education and good nutrition kind of also play into that. But currently, researchers really feel like lower incidence of infectious disease is probably the #1 external impact to IQ. So I just thought I'd throw that in there. Obviously, head trauma is going to impact IQ as well. But these are all good things to keep in mind when we're doing an intake to make sure that our clients are getting good nutrition, like an anti-inflammatory diet, have access to games and other manipulatives to grow their skill set, and also have access to medical care. Okay, so just to wrap up, there are lots of wonderful IQ and achievement tests available to practitioners out there in the world. Here are some others: the Wechsler Intelligence Scale for children, the Wechsler Intelligence Scale for adults, Woodcock-Johnson tests of cognitive abilities. Again, we mentioned the Stanford-Binet Intelligence Scale, differential ability scales, the Peabody Individual Achievement Test, the Ravens Progressive Matrices, Cattell Culture Fair 3. So lots of tests. What you need to know is that there are specific licensing requirements. So if you're going to choose a different test, make sure that you are able to bill and code for that with your licensing and administer that. If you go to each of the websites, you'll be able to look and see what the licensing requirements are to administer each of these tests. Have fun. I love this part of our workup.